my name is Madupe. Welcome to my YouTube channel. I'll be going into the journey of my pregnancy, pre-conception. For the sake of this video, I'm going to try to differentiate my healthcare providers. Normally, I'm under the care of clinical hematology because of my sickle cell. And when we wanted to get pregnant, we had a consultation with another team, which was hematology and obstetrics. So our first visit was in February 2024. When we got there, we let them know that we wanted to get pregnant. We wanted to start trying. They told us how our care routine would be when I get pregnant and what they would do to make sure that I'm well taken care of and the pregnancy comes out as best as it can. I had my worries, I had my fears, and we were told to go home and enjoy ourselves. Fast forward to April, I missed my period. Immediately, I contacted my clinical hematologist. God bless my consultant. He's a very nice person to me. He made sure to contact that team that we went to visit earlier on, which is obstetrics hematology. Contacted them, and I think I should just say right here that before I got pregnant, my care routine was folic acid and vitamin D daily. 2,000 units of vitamin D and 5 milligram of folic acid. So that's what I've been taking. And I know some people will be like, oh, you're not taking antibiotics, because if you got sickle cell, they tend to put you on prophylaxis antibiotics. But for me, growing up, I didn't have that. What my pediatrician did was, whenever I had an infection, whenever I had a crisis, then he'll put me on antibiotics, which is for like 7 days, 2 weeks, and and after that he takes me off the antibiotics. So I was kind of used to that method of treatment. When I linked up with my consultant here in the UK, he offered penicillin, but then I told him how I've been treated back home, and agreed to continue it that way, and that in event of me having an infection or getting exposed to an infection, then I could take antibiotics. Now, when I told him that I was pregnant, he immediately put me on antibiotics, which was is it azithromycin? Erythromycin, sorry. He put me on erythromycin, and that was for the full course of my pregnancy. I'm sorry, my baby is just cooing and distracting me. Yeah, so back to my story. Then I had my first appointment with the team, and I had first appointments with the midwife. I was told that for the course of my pregnancy, I would have a midwife visit and a visit to the consultant teams and a scan and blood work. So it was arranged in a way that before I go to see the team, I visit my midwife. Fast forward to my first visit to the midwife. They took my whole family history, my husband's family history, health history, of course, his parents' health history, my parents' health history, and they asked loads of questions. Of course, if you're comfortable answering those questions, that's when you would answer them. But I had nothing to hide, because I wanted this. I needed to be as plain as possible, an open book. I gave them my history and everything. I had my first appointment with the team, and I was told I'll be put on some medications to help with the pregnancy. To me, those medications got me worried, because I was like, how can I be on these medications throughout my pregnancy, and some of them even after birth? That was when I started doing research online to see what the management for sickle cell and pregnancy was. To my surprise, there wasn't much information out there. Even the videos that I saw on YouTube were like 16 years old, 5 years old. I'm like, where are the current videos? Where are the updated videos? Anyway, I was told that I would be given all those aspirin, continue my vitamin D3, my folic acid, and I'll start the whole molecular weight heparin For those of you who don't know, low molecular weight heparin is a blood thinner injection, and this injection is to prevent deep vein thrombosis, which is, it prevents blood clots in your legs. And you know, when blood clot travels from your legs to the heart, it can be very, very dangerous. Those medications and injection, I'm trying to, of course, the antibiotics, trying to remember what other medication I was prescribed. As at that time, I had just completed 35 years old, and I was told that because I'm 35, I have to start the injection as soon as possible. Because being 35, you know, when you get to 35, you hear things like geriatric, high risk. So being 35 made it double high risk for me, because one, the first risk, I already had sickle cell, and the second risk, at that age where it's considered to be risky to get pregnant. According to their calculation, I think they have a scale of the risk and what you need to do. As so basically, it's like, okay, if the person is at so risk, so care needs to be taken. For me, it was starting that injection, taking the aspirin, low dose aspirin, and the antibiotics, and of course the medications I was already taking. I told them I needed time to think about it. Well, I went back to think about it, and I started doing my research. If you're suffering from sickle cell and you are high risk, like you're already geriatric age, then you need that injection, because it was my first time hearing about it, and I saw the side effects. Mind you, when I was in that office and I asked the obstetrician and the hematologist this question: what are the side effects of that injection? I was told it's just redness and sore at the place of injection. I went home, I did my research, saw some side effects that I was not comfortable with. These side effects got me thinking, like, girl, I have to take this injection for 9 months and even beyond, because that's what is recommended. Here, I'm going to make a disclaimer. I am not telling you that you have to do what I did. No, you need to be sure of how your body works, and you need to be sure that you're ready for the consequences for whatever decision you make. Having said that, I made my decision, and I told them, my question was, if I was 34 years old and 11 months, would you make me take, or would you advise I take this injection at the start of my pregnancy? And they laughed and they said no, but there has to be a cutoff, and the age was 35. I told them that I would like to wait until the 3rd trimester, because the 3rd trimester is considered a time where, even if you're not geriatric, for the fact that you've got sickle cell, you have to take the injection. It's strongly recommended you take the injection. I told them that I would like to wait till when I'm 38 weeks gone, because I'm still very active and I could move about, I could take walks, and I'm not just sat somewhere that could my chances of getting DVT. They're like, okay, if that's my decision, that's fine. But when I get to 28 weeks, which is the start of 3rd trimester, I would have to take the injection. They would strongly recommend I take the injections. I said, no problem. Let's get to 3rd trimester. I started with the low dose aspirin, antibiotics, continued with my other medication. Another thing that got me worried was antibiotics, because first of all, I'm not on a treatment regimen where I was on antibiotics constantly. I had augmentin when I had when I'm exposed to infection, or I have infection, so I take augmentin. So I'm not used to taking erythromycin every day of my life. I know some people do take these antibiotics as part of their treatment regimen, but in my case, I don't take it. I started thinking and worrying about the side effects of having to take antibiotics. And even though I was told it was prophylaxis, to me it seemed that the dosage was like normal dose. I couldn't stop thinking of how antibiotics might affect my baby, because I think there's just something about pregnancy that when you're pregnant, You stop thinking about yourself. You stop worrying about yourself. Automatically, you're concerned about your baby. Feel comfortable with continue with the antibiotics because, I mean, it was gonna be 9 months. I stopped my antibiotics. Disclaimer again, I'm not asking you to stop any medication. Whatever you're doing, do it with the advice of your consultant. You should understand yourself enough to know what's right for you. If I were on antibiotics previously, I would have continued. And I stopped these antibiotics with the conclusion that if I am exposed to cold or I'm exposed to whatever I think I'm not supposed to expose to, I will immediately get on the antibiotics. Or if I'm already feeling like I've got an infection, I will immediately resume the antibiotics. So that was how I thought to manage myself with the antibiotics. So I stopped it. Now, mind you, at that period, I work hybrid. I don't go out all the time. Yeah, and when I go out, I'm always like very careful. Fast forward to the end of first trimester, beginning of second trimester, I got a call from my midwife that my hemoglobin level was low. My hemoglobin level is about 105. Every time I go for my checkup, it's around that 105, 102. I went from 105 to 90, and I think the normal level is like 120. Mine was 105. I was told by this midwife that I needed to be on iron tablets. I said, okay. I went and bought the iron tablets. The day I bought the iron tablets, I didn't take them. And my appointment with my team was the next day. I got there before they start this session. Well, before they start the consultation, they ask you, so you're on so medications. I'm like, yes. But then they missed the iron. And I'm like, hold on, including iron. They said, no, we didn't prescribe you iron. I said, but a midwife prescribed me iron. And they said, no, that from my last test result, I didn't need iron. My levels were okay for me as I had sickle cell. It would get to a certain level where they would have to recommend iron. There's a way they differentiate it, ferritin and the hemoglobin. They said the ferritin was very okay and the hemoglobin is normal for me. I shouldn't take an iron tablet. I was like, okay, then I stopped. I didn't start it, so rather I didn't take the tablet. We progressed to, I think towards the end of second trimester, my levels kept dropping. And they told me that it's kind of similar with people who don't even have sickle cell. So long you're pregnant, your hemoglobin level or your blood level drops. At some point it dropped to like 78 and I was told to start taking iron tablets. Well, I do not want this video to be very long and my little one is already like cranky. I'm going to make another video of what happened after that, after I started the iron tablets. Stay tuned for my next video. Bye.